Welcome back. In this video, we'll be diving into the economic implications of depression, focusing on both its consequences in the workplace and its broader impact on society. Depression doesn't just take an emotional toll, it also has a significant financial impact on individuals, businesses, and entire economies. Let's explore how. Let's start with the workplace. Depression is one of the leading causes of absenteeism around the world. For many people, when they're struggling with depression, going to work feels like an impossible task. The physical and emotional exhaustion that comes with depression makes it incredibly difficult to be productive, leading many to take time off work. In fact, depression is responsible for more than 200 million lost workdays annually in the United States alone. This amounts to an estimated $210 billion per year in lost productivity. Globally, research indicates that depression costs companies billions of dollars each year due to absenteeism. The World Health Organization estimates that the global cost of depression in lost productivity alone exceeds $1 trillion annually. But it's not just about missing work. Depression also leads to presenteeism, which happens when employees show up for work but aren't able to perform at their usual level due to mental health challenges. This can be just as costly, if not more so, because while employees are physically present, their productivity and performance are significantly impaired. Studies show that presenteeism due to depression can cost companies twice as much as absenteeism. This is a major issue because employees who are at work but not fully engaged can cause a decline in quality of work, decision-making, and creativity. This decreased performance can also lead to slower response times, reduced team morale, and ultimately a loss of competitive advantage for the business. Let's break this down with some statistics. According to research, presenteeism due to depression costs the US economy more than $150 billion annually, which is more than the costs associated with absenteeism. When we consider the broader impact of depression on global economies, the World Health Organization estimates that depression is the leading cause of disability worldwide, contributing significantly to the economic strain that countries face. Questions. How do you think the financial costs of depression in the workplace might affect a company's policies on employee well-being? In what ways do you think businesses can reduce absenteeism and presenteeism related to depression? Now let's look at the broader economic impact. Beyond individual workplaces, depression has a ripple effect on national and global economies. It's not just about the lost productivity from a few workers. It's about the overall economic burden of mental health issues. The World Health Organization estimates that depression costs the global economy more than $1 trillion per year, a staggering figure that reflects its impact on both productivity and healthcare costs. Countries with higher rates of depression often see an increase in healthcare costs. People with depression require medical treatment, including therapy, medication, and sometimes hospitalization. These healthcare costs can add up quickly, particularly in countries where mental health services are not adequately funded or accessible. In fact, mental health conditions, like depression, account for around 4% of total global healthcare spending. Additionally, depression is closely linked to other chronic health conditions like cardiovascular disease, diabetes, and obesity. The double burden of managing both physical and mental health conditions significantly increases healthcare costs. For example, individuals with depression and chronic conditions may have more hospital visits, increased medication needs, and higher long-term care expenses. This adds pressure to already strained healthcare systems. Another economic challenge is the rise in disability claims related to depression. As depression is one of the leading causes of disability in many parts of the world, an increasing number of people are being granted disability benefits due to their inability to work. This not only affects the individual's income, but also places a strain on social welfare systems that are responsible for providing these benefits. Let's put this into perspective. The European Union has estimated that depression costs the region over $100 billion per year in lost productivity and healthcare expenses. This number represents a significant portion of the region's economic burden. and shows just how costly depression is for entire economies. When depression is untreated, it can have a cascading effect where the personal financial stress worsens the depression, and in turn, the depression worsens economic hardship. On a more personal level, people with depression often face financial difficulties because their condition limits their ability to earn an income or maintain a job. Many individuals may have to take time off from work, switch to part-time roles, or even leave the workforce entirely. As a result, they often face income instability, which can worsen their mental health and create a vicious cycle of financial and emotional stress. And it's not just the employees who are affected. Employers also face a significant financial burden due to depression. When employees with depression leave their jobs, companies incur the costs of turnover. This includes the recruitment, hiring, and training of new employees. Additionally, the cost of sick leave and the need to provide accommodations for employees dealing with mental health challenges further adds to the financial strain on businesses. However, the good news is that depression is treatable, and when people receive the care they need, they can return to work and contribute effectively. In fact, studies have shown that providing mental health support in the workplace can significantly reduce absenteeism and presenteeism, improving overall productivity and employee engagement. Research has also found that for every dollar spent on mental health programs, businesses see a $4 return in increased productivity. That's a significant return on investment, showing how investing in mental health isn't just the right thing to do for employees, it's also good for business. Reflection. What types of mental health programs do you think could help improve productivity and reduce the economic burden of depression in the workplace? How might businesses benefit from investing in employee mental health programs? To summarize, the economic implications of depression are enormous, both for individuals and society at large. Depression leads to absenteeism, presenteeism, and disability claims, all of which cost companies and countries billions each year. However, with the right treatment and support, individuals with depression can return to work and regain their quality of life. Investing in mental health support not only improves employee well-being, but also boosts productivity and reduces costs for businesses and economies as a whole. In the next video, we'll look at key statistics related to depression, examining global rates and the associated costs of this condition. Let's keep it going, and I'll see you in the next one.